What happens if you've identified a coworker or a subordinate that you're supervising who has problems with stress, anger, impulse control, depression, anxiety, problems staying alert, problems with attention, and you're trying to decide if they need a fitness for duty evaluation. You know, first of all, knowing them and realizing that there's been a change is, is the first step. It takes a little bit of time and sensitivity, and I don't know about you, but I've had some supervisors that weren't really all that sensitive. But yet, I think it's a really important part of the job. And sometimes just talking to people about it in a non-threatening way, letting people know that you have their best interests at heart, and a timely referral to an employee assistance program, which could then make a referral for professional counseling if that were necessary, or psychiatric treatment, or a change in the medications that they're taking from their primary care doctor. Any of those interventions early on could avoid a tragedy or avoid the need for a fitness for duty evaluation. And one thing in the medical field that we talk about is how to deal with a sentinel event. A sentinel event is not a good thing. And usually it's when something bad happens and you do a debriefing and to evaluate how this happened and how it could be prevented in the future. One of the things that's important to do as part of that debriefing is to provide some support for the person involved. If you call someone on the carpet and then shun them, for some reason it's not a good way to manage personnel, and you could lose a valuable person that you've invested a lot of time and energy and training in. Just by not offering support, but just by letting people know that these situations happen, and it doesn't mean you're a bad person, it doesn't mean that you're worthless, and exploring if anything needs to be done to help them in the future. I mean, it may just be, that they were in the wrong place at the wrong time, and there's nothing that could have been done differently. But in that case especially, they need support. I think if somebody really messes up and is in trouble, they need support. And especially if they're going to be terminated or something like that. So I don't think we should ever be afraid to be human. Everyone's worried about human resource management and getting into legal problems, etc. But just being caring, taking time to talk, doesn't mean you have to make some legal commitment that's going to get you in trouble. But I think that can be a big, important factor. And I think one of the factors, especially with law enforcement or emergency response personnel, is dealing with post-traumatic stress disorder. I trained at the University of California at San Diego, and Sid Zizik and Steve Schuchter there did research on a plane crash that crashed into a neighborhood of San Diego, North Park. And the firemen that responded to that crash had an extremely high rate of post-traumatic stress disorder, just dealing with body parts and people that were killed in their homes, etc. And it taught us a lot about how to try to prevent a disabling condition like post-traumatic stress disorder by early referral to counseling. In a battlefield situation, you ideally do counseling right away, provide support, get people back to their unit where they can talk to friends and coworkers that understand what they've been through. And I think that's true for law enforcement and emergency personnel as well. But these conditions can be disabling for the rest of their life. So it's important to have a strategy in place to try to prevent that kind of psychological damage. And I think that should be part of the policy of any organization in dealing with emergency situation, or Sentinel events, as we call them.